Hey, it's Lynn Pierce again, and I'm going to demonstrate my physical examination of the abdomen. And like any physical exam, we first start with observations. Observation of the area, looking for any abnormalities, making sure that sides are even, making sure that I don't see anything, any masses protruding or anything of that nature. And while I am doing my inspection, the next thing I'm going to do is I'm going to listen for bowel sounds in all four quadrants. And Cameron, this stethoscope may be a little cold, so brace yourself. You should be able to hear bowel sounds just readily moving around in there. They are very active, and her bowel sounds were really active. So while I have her laying down and while I am on her stomach, I'm going to listen at her aorta to listen for any bruise or anything abnormal. So I'm going to find her umbilical area, and I'm going to go right above that to listen at the aorta. Okay, and I didn't hear anything abnormal while listening to that area. So as we finish listen at the aorta, I'm just going to come diagonally to listen right here as I listen as the arteries branch off to the kidneys on both sides, and here. And on this side, I'm just going to listen at her groin just a little bit. Okay. Just again, make sure that there is nothing unusual to be heard in that area. So now I'm going to do some percussion, and I'm just listening for sound. Remember I said, well, maybe not, but when you percuss over air, the sound is a little louder. When it's over fluid, it's less loud. So again, placing my non-dominant hand down, taking my dominant hand and tapping the last joint of my index finger. So I'm going to now lightly palpate the abdomen. And what I'm doing is I'm taking my fingers and I'm checking for any pain or any discomfort. Cameron, does that cause any pain or discomfort? Okay. And that was gentle palpation. So now what I would like to do is estimate the size of the liver. And so what I'm going to do is I'm going to start here around the umbilical area, and I'm just going to start percussing outward. And what you want to do is go to where the sound moves from a tympanic to dull. When you get to that dull sound, you want to mark that area. Then you want to go up to the rib cage and make sure that you're not percussing on the ribs, but between the ribs, and percuss to find that upper level of the liver. And again, when the sound moves from to that tympanic, or that from dull to tympanic, you know you have found the upper portions of the liver, and that's where I would measure the upper areas of the liver. So now what I'd like to do is percuss the splenic area, And to do that, I go to the lateral side, and I start at the base of the ribs, and I start percussing until that sound goes from a tympanic to a dull sound. I don't really feel the spleen. Take a deep breath in and out for me, Cameron. And you don't want to feel the spleen, because if you would, that would indicate some abnormality there. The next thing I'd like to do is do a test that would indicate appendicitis. So I'm going to find my umbilical area. If I would draw a line here and go about in between and press on this area, and if that would cause tenderness, that would be where the appendix is located. So what the rebound test is when you deep press in and let go, and you ask the patient whether or not the pain is more severe when you push in or let go. That's called the rebound effect. Especially if I was on this side and pushed in and let go and the pain hurt on this side, that would be indicative of appendicitis. So that's one way how we can test and check the appendix once we're doing our abdominal exam. So now what I would like to demonstrate is the arbitrary test. And that's a test where you hold the patient's leg right above the knee. You take your other hand and grasp the ankle, and you rotate it laterally and medially. And if there is a rebound in pain, it could indicate some type of inflammation in this area. Now I'd like to demonstrate the what's called the iliopastal muscle test. So I asked the patient to, actually I'm going to have you turn on your side, Cameron, if you would, way down, and then I'm going to pull the leg back to see if it causes any type of pain. Is that painful for you, Cameron?
Yes.